erythritol, which is actually one of the sweeteners in here. So it's produced naturally by your body, and it's about 70% as sweet as sugar. What they found in this study was that people who had higher levels of erythritol in their blood were much more likely to die from heart attacks. And it was a powerful effect. Now here's the issue. This population was very sick people. Over 40% of them had already had a heart attack. It's fine to pull from that population, but then the media has got to be much more careful with how they present this to folks. You're thinking, oh my God, I had a monster. I'm going to have a heart attack tomorrow. When in reality, they're talking about people who are old, very sick, very high risk of death anytime. Yes, there was a very high correlation between the levels of erythritol in their blood and their risk of dying from heart attack. Guess what happens when you're really sick? With like, I think they call it like syndrome X, which is these folks. You produce a lot of erythritol because it's produced by the pentose phosphate pathway, and your pentose phosphate pathway becomes like kind of hyperactive. They didn't look at all at their dietary
consumption. So that could technically be an indicator of poor health. The more you have.
Bingo. Okay. Reverse causality.
Wow.
Okay. I am not convinced at all consuming for sweet beverages sweetened with erythritol is dangerous.
I really appreciate you doing that.
Because why wouldn't you just, if you're going to try and extrapolate this to diet, why not do dietary recall?
And they don't look at their consumption. They just looked at that.
No.
Wow, that's incredible.
It warrants further investigation. It's not a bad study. It's just the over-interpretation of that study is what the problem is.
Misleading.